Hello, everyone. My name is Jennifer Russell, and I'm the Recruitment and Communications Specialist for the Global Health Fellows Program 2. I'd like to welcome you all to this webinar today. We're very excited about the presentation we've prepared for you, and I'm so happy to see that so many of you have decided to participate. At this moment, we have more than 150 participants online with us, and that number is climbing. I hope you find the information we present to you both interesting and, of course, useful for when you're crafting your summer 2014 Global Health Internship application. Before we start, I'd like to go over some general housekeeping items with you. We're excited to offer closed captioning for this webinar. If you'd like to read a transcript of the webinar in real time, you can access this feature by expanding the media viewer. The media viewer is in the lower right-hand corner of your screen. Please note, though, that these screenshots are from a PC. If you're using a Mac, the menus may be in different locations. To best view the transcript, you'll want to click on the Show Hide header, which is also in the lower right-hand corner of your screen. You can see it on this slide here. To enlarge the panel to better view the transcript, you can click and drag the edge of the panel to the desired size. You can also resize any of the other panels, including the Q&A and chat feature. The following slides will show you how to quickly reaccess the Media Viewer window should it collapse during the course of the presentation. You can reopen the window by clicking on the Media Viewer icon, which you should see at the top right-hand corner of your screen. As you can see from the image on this slide, it is the furthest icon on the right. Clicking on this icon will reopen the closed captioning feature. Please note that a transcript of the spoken content will also be available after the webinar, as well as a recording. They will both be on our website, www.ghfp.net, within 1 week following this event. Thank you to both Star and Joanna, who are available should you run into any technical difficulties. If you run into technical difficulties at any time throughout the course of this presentation, please call the number on the screen or submit a question through the Q&A function, which I'll go over next. You might also want to jot this number down for future reference in case you need to call for assistance. As you know, we solicited questions from you when you registered for this webinar, and we've been able to incorporate the answers to many of these questions into the presentation that you're about to experience. You can also submit questions at any point throughout the presentation by using the Q&A feature. We'll try to answer as many of your questions as possible at the end of the presentation. Please note that when sending in your questions, be sure to send your question to all panelists, which you see circled on the slide. And just to give you a brief overview of what you can expect during the next 90 minutes or so, here is a preview of what we're going to be covering. The main focus of this webinar is to help you best present your strengths in your Global Health Internship application, as well as strategies for using the next few months to prepare yourself even more for global health opportunities. We have some great presenters here with us today, and I'd like to introduce them to you now. Bob Leone is the GHFP-II lead for communications and outreach. Bob has reviewed thousands of resumes and internship applications and has extensive experience providing targeted feedback to people interested in pursuing a career in global health. Burke Betts is a GHFP-II Summer 2013 Orphans and Vulnerable Children Monitoring and Evaluation Intern. Burke is able to provide an insider's perspective as to what it is like to be a GHFP-II intern, as well as the contributions he and his internship made to USAID. Throughout the presentation, we will also be asking a few questions of you. You can respond to these questions by utilizing the polling feature, which you can see on the slide here. And I would encourage you to participate if you're able to. We will share the results of these polls at different times throughout the presentation. So next, we're going to go over the first two poll questions. The first poll question is, how familiar are you with GHFP-II? So please choose an answer in the lower right-hand corner of the screen and be sure to click Submit, which you will see in the lower right-hand corner when you're finished. You'll have 3 minutes to answer the poll question. And we also have another poll that we'd like you to answer, which is, Where do you primarily search for internship opportunities? And you can choose all answers that apply. As I mentioned before, we'll be sharing the results of our poll questions with the audience a little bit later on. I'd like to give you a brief overview of the Global Health Fellows Program II, and also a little bit of information about the United States Agency for International Development. As our name indicates, we are in the second iteration of the Global Health Fellows Program II. The first was from 2006 to 2011. GHFP-II works with USAID by recruiting, placing, and supporting fellows and interns to work with the agency in Washington, D.C. and overseas, and providing them with career and professional development support. These global health professionals are representative of the diversity of the American people and serve as important contributors to USAID's success in key global health priority areas. The United States Agency for International Development is the largest development organization in the world. It serves as the development arm of the U.S. government and implements the U.S. government's foreign assistance agenda. Within USAID, global health is the largest portfolio, exceeding $5.5 billion in funding year 2011. Within the broad field of global health, USAID divides its work into environmental health, family planning, health systems, HIV/AIDS, infectious diseases, maternal and child health, and nutrition. GHFP-II works with USAID in all of these areas and more. As you can see from this map, virtually no area of the world is outside of the agency's work. And the Global Health Fellows Program II is one of several initiatives that allows USAID to access diverse talent to address its long and short-term needs. GHFP-II is unique in its contributions and combination of opportunities available in the professional and career development we offer to individuals participating in our program. Although our fellows and interns work within USAID, they are employees of the Public Health Institute, the lead partner of GHFP-II. Our GHFP-II partners include Management Systems International and CDC Development Solutions. More information about these partners can be found on our website. One of GHFP-II's collaborating organizations is Global Health Corps, and another is GlobeMed. GlobeMed reaches over 2,000 undergraduates a year through its university-based student-led chapters. If there's a GlobeMed chapter at your school, it's a great place to start exploring your career options in the field of global health. And if not, you could also consider starting a chapter at your school. Currently, we have approximately 120 fellows and will soon be recruiting for our summer 2014 internships. There are also internships available throughout the year. Each of our internships has specific requirements, ranging from completion of an undergraduate degree to enrollment in a graduate program. These positions are competitive, and a little later on in the presentation, Bob Leone will be speaking about how to best present yourself within the context of your application. Fellowships are at all levels, and the jumping off point for a junior level fellowship is an MPH or similar degree plus 1 or 2 years of relevant experience. Each fellowship has its own very specific scope of work. The fellowships are for 2 years, often with an option to extend for additional 2 years, with placements in Washington, D.C. and overseas. U.S. citizenship or permanent resident status is required for both our internships and fellowships. The fellowship program does provide for families to relocate to overseas positions. However, there is no such provisions for internships. And as you can see from this slide, fellows and interns have worked in a variety of locations. Countries listed in white are those where we have had or currently have fellows, while those countries in red are where we've had both fellows and interns. Lastly, countries listed in blue are those where we've had interns only. Areas that both interns and fellows have worked in are varied. This list that you can see on this slide is not exhaustive. We currently have fellows working on animal-to-human transmission of disease, voluntary medical male circumcision, behavior change communication, pandemic threats, and other areas not listed. If it's done in global health, chances are we've had an intern or fellow who's worked on it. Now, I think the results from the first and second poll should be available now. Star, could you please display the results? So you can see here, so the first question was, how familiar are you with GHFP-II? So it looks like most people are somewhat familiar or not very familiar. And there's a few of you that are very familiar and some of you who are not familiar at all. So it's kind of all over the board, but with people kind of mostly in the middle to of somewhat familiar or not very familiar. So we hope that this presentation really helps you gain some greater familiarity with GHFP-II. And also, you can also go on our website and find additional information about GHFP-II as well as resources. And our website is www.ghfp.net. And then the second poll question was, where do you primarily search for internship opportunities? And it looks like a majority of you find internship opportunities through your school. And then let's see, some of you also use LinkedIn or other kind of networking through specialized global health. So it looks like it's kind of varied, but with most of you finding out about internships through your school. And I would like to mention that we do have both a LinkedIn and Facebook page as well as an email list, and those are all great ways to find out about our internship and fellowship opportunities. As part of the program's commitment to developing the next generation of global health professionals, GHFP-II seeks to provide the first crucial global health experience to as many candidates as possible. Applicants with the most experience aren't always the best candidates. Rather, we seek those who might gain the greatest benefit and from whom USAID and partners will gain excellent assistance and fresh perspectives. We do specific outreach to historically Black colleges and universities and Hispanic-serving institutions, including holding information sessions and participating in career fairs at such institutions around the country. We are also very interested in recruiting veterans for our program. Their skill set can be very valuable in the global health field, including the ability to work with different cultures, flexibility, creativity, and strong teamwork. We are also interested in mid-career changers and give equal consideration to mid-career changers in the internship review process. And lastly, we have recently enhanced our efforts to reach hearing impaired individuals by providing closed captioning in our webinars. So now we have a third poll for you to answer, which is, what are some barriers to careers in global health? And this is another one where you can select multiple answers. Again, you'll have 2 minutes to answer, and please be sure to click Submit when you are done. Before turning the presentation over to Bob, I'd like to remind you about how to access the closed captioning feature should the window close. So to quickly access the feature again, you'll want to click on the Media Viewer icon. So if you're on a PC, you'll see that Media Viewer icon at the top right-hand corner of your screen. Also, please feel free to submit any questions you may have at any point in the presentation by using the Q&A feature. We'll try to answer as many of these questions as possible after the presentation. And now we're going to move on to the part that you've all been waiting for. How can you best present your strengths in your global health internship application? And what can you do the next few months to prepare yourself even more for global health opportunities? And so at this point, I'm going to turn things over to Bob Leone.
Great. Thanks, Jennifer. It's really great to see so many of you on today, and I really hope that this is going to be useful to you. This is just a quick look at some of the topics that we're going to be covering in this section. And as you can see, we've got a lot of material to go through, but I think it's going to be really tailored to hopefully to your needs. A career in global health can be really exciting and satisfying. It offers many opportunities to utilize your skills and experience in ways that impact populations around the globe. A global health career will also have high levels of complexity that can be challenging. For example, later on in your career, you could be working in the field as a population health and environment technical advisor in the Lake Victoria Basin, or LVB as it is commonly known. And in fact, we have a fellow who is in that particular position. The LVB covers 5 countries in East Africa: Kenya, Uganda, Tanzania, Rwanda, and Burundi. This shared ecosystem provides a livelihood in the form of fishing and agriculture to 80% of the region's population. 2 million people make their living from fishing. 22 million people rely on consumption of the lake's fish. Factoring in all of the challenges faced by these populations, including high maternal morbidity and mortality, an unmet need for contraception, and prevalence of HIV/AIDS and malaria, it's easy to see that to be successful in this kind of a work environment requires a substantial array of technical and fundamental skills. So how does this relate to preparing yourself for a summer internship with GHFP-II? A substantive internship can be a great stepping stone to a position such as this PHE technical advisor job I just described. Needless to say, you won't need to have all these skills that a PHE advisor needs in order for you to be a competitive applicant for an internship. But you will need to have a reasonably good understanding of what it takes to do that kind of job and others in global health. So these are some of the skills required for this particular position. To start off, I'd like to thank all of you who took time to submit questions to us beforehand. We received close to 200, and they have been really invaluable in helping us structure this webinar. I'm going to answer some of them right now outright, and others will be woven in throughout the presentation. Where are the internships based? Most are based in the Global Health Bureau at USAID in Washington, D.C., although many interns will also have the opportunity for overseas travel during the course of their internship. Some may also be based overseas. What are the qualifications for a GHFP-II internship? All the positions require that you be enrolled in school or have completed your degree within the last year. Each internship will have its own specific scope of work. You should review the openings available and then apply only for those positions that you feel are a good match to your skills and experience and your desires for the future. All internships, as Jennifer mentioned earlier, require U.S. citizenship or permanent residence status. Most of the positions will require enrollment in a graduate program or having completed your degree less than 1 year prior. There will also be some openings for those with an undergraduate degree. Please note there is no age restriction. We have had interns in the past at many different stages of life. Is an MPH degree required? An MPH is not required. Our interns are pursuing various degrees: MSW, MPIA, MPP, PhD, medicine, clinical nursing, and others. And 45% of our fellows do not have MPHs. Some of our interns use our program to meet their practicum requirements. What does the application process look like? When you apply for a position, we screen through the resumes looking for those resumes and essays that speak to the requirements and experience that we're looking for. We then select the top resumes and forward them to the hiring manager at USAID. The hiring managers then select candidates to interview, and once interviewed, a final selection is made. An offer is then made to the candidate after reviewing references. Then the onboarding process begins. What do interns actually do? Each internship is different. You could be doing research, report writing, participating in technical working groups, conference calls with the field, traveling to the field for site assessments, coordination with partners, collaboration on a project, data analysis, developing presentations, and more. Please note that interns work at the policy, program design, evaluation, and management level, not at the project implementation level. Is the content of the internships already set, or are they flexible in terms of what you can do? Each internship has its own scope of work, which can be broadly written given that each sponsoring office is looking for a particular skill set. Once a finalist starts, he or she develops a work plan with their on-site manager, and that is really tailored to that person's specific interests and the specific work needed to be done at that time. How does GHFP-II prepare and support interns in their careers? The interns, during their internships, receive a substantial amount of training, career guidance, and networking opportunities that will help them in preparing for their next move post-internship. How long are the internships, and are they compensated? Starting in the summer, the internships range from 12 weeks to 6 months, depending on the position, and they are compensated depending upon your experience. There will also be other internships throughout the year. Can the internship lead to a more permanent position with the Global Health Fellows Program too? In the past, some internships have led to full-time positions, but not as direct path, i.e. An intern directly into a fellowship, which is the more senior level positions that we have. Yet the vast majority do not by design. These internships are learning opportunities which are designed to be time limited. Those interns who become fellows did so after completing their coursework and then openly competing for a fellowship. Note that some interns have been offered positions with USAID immediately following their experience. However, those positions have been with other programs that are not fellowships. And then finally, how do I gain international experience? So this question comes up very often, and it's sort of the classic catch-22 situation. You need international experience to get your first job, and it's very difficult to get your first job without international experience. So I'm just going to give you some of the options and that we've sort of determined, and also some ways to make yourself a more desirable candidate. Internships, of course, organizations like the Peace Corps, volunteer positions, even if they're short-term. If you happen to belong to a church that does overseas missions, that's another great possibility. We also recommend research and finding ways to contribute to organizations based here in the U.S., oftentimes smaller ones, where an overseas opportunity might become available once you've proven yourself. There's an organization that Jennifer mentioned earlier called GlobeMed, which is one of our partner organizations. And if there's a chapter on your campus and you're an undergrad, you should consider checking that out. And if not, you could, if there isn't a chapter on your campus, consider starting one. It's a great way to get your foot in the door and to have an overseas experience. And their website is globemed.org. Developing a good working knowledge of the political, economic, and social forces that shape the world, that's a really, I think, a really important thing to get the big picture. If there's a particular region that interests you, start there. Develop business and management skills, such as budgeting, project management, and people skills. Those are all going to be really important. And learn another language. Also, being entrepreneurial. Your way into the field is going to require some creativity and the ability to see an opportunity and take it, even though there may be some uncertainty involved. There is really no cookie-cutter approach. It will be different for everyone. And that sort of mindset aligns very well with what global health employers are seeking in candidates. And also note that not all overseas experiences are created equal in terms of applicability to our particular program. We're looking for experience in resource challenge settings worldwide, not just any experience outside the U.S. So, for example, a semester abroad in Geneva or Rome isn't nearly as relevant as working with the United Way in an urban area, or as a health outreach with a health outreach organization in Appalachia, or a one-month volunteer or work experience with an NGO in a developing country. Those are all really great experiences. So how do you decide if you should even apply for a particular position? Before you do anything else, research the company or organization online. Are they aligned with your areas of interest? Does your background seem like a good fit with the organization? Be sure that you understand what the organization works on. We've interviewed more than our share of people who think that global health means health care. Once you've done that, there is an unshakable rule of thumb. Read the scope of work carefully, then read it again. Then pay particular attention to the qualifications section. This will often be a bulleted list of skills, knowledge, and experience, starting with the most important. Let's say the list has 8 bullet points. If you have some of them pretty solidly, then that would be a position to apply for. A good rule of thumb is 70% of the requested skill set, and not the fluffy ones like multitasking or works well in teams. They should be skills that are quantifiable or measurable, such as years of experience, language skills, computer skills. If most of the bullet points are a real stretch for you, it's probably not worth your time to apply, since others will have those skills and they are the candidates that recruiters and hiring managers will want to speak to. If you would like to know more about a particular nonprofit organization as you're doing your research, including financials, check out guidestar.org. So being realistic, that's also a really important thing. So you don't want to undersell yourself and you don't want to oversell yourself. For example, if a scope of work is seeking someone with 1 year of experience implementing community-based health programs overseas and you have none, you're not in the ballpark. But if collectively you have 8 months of experience, including several 2-month internships, then go for it. Also keep in mind that scopes of work are really describing an idealized person. The organization would really like to find someone exactly like the one they have put down on paper, but that person probably doesn't exist. So if you're strong in some areas and not as strong in others, keep in mind that the reviewer will be looking at the complete package. Talk about your contributions within the context in which you worked, so that a reviewer can see the connection to the organization or team. In many cultures, the idea of talking about yourself sort of has a sense of that you're bragging or gloating and can be considered unseemly. In this case, we encourage a professional, straightforward depiction of your success. That's not what we would consider bragging. And your selection for any type of position depends on providing that kind of information. The field of global health is competitive, and standing out from the crowd is pretty common advice. But what does that mean exactly? Before I get into that, let me address an issue that comes up often. You might think that some of what I'm going to be talking about is pretty basic stuff: good writing skills, good interviewing skills, the importance of networking, obvious things you already know. As an employer, GHFP-II sees thousands of resumes and hires more than 100 people annually. And the reason I'm going over some of these more basic issues is because that they come up time and time again, consistently, not only among candidates who are just beginning their careers, but among those who have had many years of experience. And these issues or problems can derail your candidacy. In other words, they can mean the difference between being selected for a phone interview or having your resume tossed in the recycling. And your resume is really only one piece of the puzzle. There are potential pitfalls and opportunities, so I'd like to point that out too, all along the road to a job in global health, starting with finding organizations that align with your goals, deciding which positions to apply for, and on through the application process and beyond. We're also trying to present what we think, not only what we think is important, but why it is important. So I've culled relevant words of wisdom from many of my colleagues here at GHFP-II. Some of the material, as I said, will be basic but important, and some will be more in depth. We've distilled it down to a format that I hope you'll find useful in your quest for a global health internship for summer 2014. When writing a cover letter, resume, or email, or when submitting questions, as many of you did for this webinar, spelling and grammar should be correct, using complete, understandable sentences. Ask a specific question. Don't just talk about what you're interested in and expect the reader to figure out what your question is. How do you stand out from the crowd in a favorable way? To use the questions we received for this webinar as a gauge, there were individuals that stood out because of the quality of their questions. Their questions were specific, grammar and spelling were good, and they did not ask questions that they could easily research themselves. They also showed a certain level of understanding of the material. These would be people I'd want to talk to. It's common wisdom that writing skills are important, even crucial in a global health career, but why? It's not just that you need a good cover letter and resume or essay to get noticed or get a job. Once in the job or internship, you'll be called upon to use your writing skills on a daily basis and in a variety of ways. All of these writing assignments will call upon your ability to write clearly in a direct style that is accessible to readers with differing cultural and organizational backgrounds. So in a sense, your resume, cover letter, or essay serve as writing samples. Reviewers will be paying attention to how well you come across on paper. It may seem basic, but we see poor writing so often. People are very vague, they fail to make a point or a convincing argument, and they often use confusing or incorrect sentence structure, which in turn will be confusing to those trying to read what they've written. So this brings me now to networking, which many people are not particularly fond of, but it is really an important piece of the puzzle when you're thinking about moving your career forward. Networking at conferences or workshops or via informational interviews can provide really valuable information when writing a cover letter or an essay. It can also provide you with talking points for an interview. Networking puts you in contact with global health professionals who are doing the kind of work that you want to do. It reinforces the idea that you are not alone. It can provide you with valuable current information about your field of interest and put you in the way of possible employment opportunities. And by keeping those contacts alive via emails when you have something of interest to communicate, such as a relevant journal article or a piece of data, you will begin to develop a network of contacts you can tap into in the future. You'll also be getting the broader background of what it takes to be successful. One way to begin is by researching and contacting organizations that align with your interests. Do informational interviews, volunteer, take part in webinars and workshops, review organizational websites. Some organizations you can look into for networking opportunities include the American Public Health Association, the Society for International Development in Washington, Child Family Health International, and the Global Health Council. Find global health organizations in your area and check out our resources slide, which you'll be seeing a bit later. Also, don't forget about your own university contacts. For those of you that are in school, it's very likely that there are faculty and staff that have spent significant time working on the very issues that you are passionate about. Talk to them. Ask them questions. What do you wish you had known early on in your global health career? What does it take to be successful in the field of global health? Ask for specific examples and stories. And in your networking, be strategic. Refine as much as possible the specific goals you're trying to reach with your networking. And evaluate all opportunities, such as informational interviews and conference attendance, based on those goals. In other words, don't waste your time. If, for example, you're attending a large conference such as APHA, the number of technical sessions and organizations in the exhibit hall can be overwhelming. Use the conference program to plan your approach. Identify the organizations and individuals you want to make contact with and focus only on them. Set a goal for yourself. I will make contact with X number of new people and organizations in my field, and I will make plans to keep in touch with them after the conference. This is the place where some well-chosen questions can really work in your favor. At conference sessions, introduce yourself. Talk to the person sitting next to you, ask them questions, visit the presenter's website or find them on LinkedIn, and while in the session, put your technology away. Texting or surfing the web sends the message that you're unavailable. So excuse me for just one moment. I'm going to take a sip of water. My mouth is a little dry. Okay, so I wanted to talk a little bit about the elevator pitch. And here's just a sample of one. And it can be used in a variety of impromptu situations. Really, anytime someone asks, tell me about yourself. It should be short and to the point and provide some insight into your work. And it should also wind up with finding some way to keep in contact with that person, especially if it's someone that you feel could be helpful to you later on. So generally, 2 minutes probably is all you would want it to be. The global health field is constantly changing. Keeping current with what is happening in global health and what is happening politically and economically in developing countries is really important. Pay attention to which organizations are currently being funded and for what types of programs. If you see large chunks of money going to a particular organization, you can assume that somewhere down the line there will be jobs available. For a window into this kind of information, you can visit AIDDATA, that's AIDDATA.org. In interview settings or in correspondence, there are a few rules of thumb. Don't ask questions that you can easily answer on your own or with a bit of research, or questions that are so broad or convoluted that they would require a very lengthy response. Also, don't ask questions that demonstrate a substantial lack of understanding of the organization you are applying to. When you're in contact with a potential employer in any capacity, you should assume that you are being evaluated. It may not be a formal evaluation, but certain judgments will be made about you and whether you would be a good addition to the organization. The questions above are indicative of a person who, to my mind, is unmotivated to do basic research, doesn't have a particular interest or passion, at least one that they've willing to share, and expects to be accommodated in some way. Internships are learning opportunities, but the organization also needs you to do a particular job. So don't lead with what you want. Lead with what you have to offer in terms of the work being done. Save the questions about pay and travel opportunities for later. So these questions, in my mind, are great for several reasons. They indicate that you've taken the time to do some basic research. You've indicated how the organization aligns with your interest and experience, and they're open-ended questions that will give you useful information about the organization. So writing a good resume and cover letter is really more of an art than a science. First of all, they should both be tailored to the position you're applying for, whether it's a full-time job or an internship. And for resumes, we have GHFP-II has a tip sheet that hits some of the high points, and you can find that on our website. Please note that the GHFP-II internship application process is completely online at ghfp.net. We ask you to submit a resume, essays, and an application form. Although in this webinar, we speak a bit about cover letters, they are not required for the GHFP-II intern application package. And the applications will be open sometime in January 2014. And then I just wanted to give you a couple of reminders. Busy recruiters and hiring managers often see hundreds of resumes for a job or internship position. As a result, they will be looking for ways to put your materials, unfortunately, in the recycling. So they can then wind up with a small selection of really solid, viable candidates. Reminder, too, is that they can stop reading at any time. There's no law that says they have to, completely go through a resume. And there are any number of things that can stop them. So here are a few of the most common. If the reviewer doesn't see what he or she is looking for right away, and what they are invariably looking for are a good match to the position, and so that they can get several well-qualified candidates that will be worth their time to go the next step with in the selection process. Spelling and grammar mistakes. Don't trip yourself up with these kinds of errors. Most reviewers will view them as a precursor to your performance on the job. And then finally, relevance is the key. Recruiters are not interested in so much in reading about the sports you play, what you like to do in your spare time, and what you have done work-wise that doesn't relate to the job they're trying to fill. Concentrate on relevant or transferable skills. So these are points from an actual internship scope of work that we've had. So just take a look at those and think about how you would address those points if you were applying for this position. And really, when looking at any position, it helps to have your resume and the scope of work side by side, so you can really do a direct comparison and find the connections between what the organization needs and your skills and experience. And if those connections are not clear in the language that you're using, it's your job to make that clear, make it more explicit to the recruiter. Use a language that they can identify with. So I'm going to talk a little bit about using an objective statement at the top of your resume versus a summary of qualifications. So in this objective statement, this is really focused all on the applicant and what he or she is looking for. It doesn't help the reviewer see what this person has to offer, and it doesn't show really that you've even read the scope of work. So it's pretty generic. Now, to my way of thinking, this summary of qualifications is much more successful and useful. It states what you have, excuse me, it states what you have to offer the organization, and also, more importantly, how these skills relate to the position that they are trying to fill. This is a quick snapshot at the top of your resume that will catch the reader's interest and, you hope, want them to know more. In other words, make them continue to read. So you're catching their attention and you're piquing their interest. I'm not going to talk too much about the essay, but I will say that be ready to write about what you have to offer in a succinct and cogent way, and be ready to write about some of your life experiences. As always, be clear, persuasive, and relevant. And what doesn't work in applications is a few things for us: name dropping, relying on admission to a well-known school as demonstrating your commitment, and not squeezing every opportunity out of your educational experience. So what I mean by that is, if you have the time, participating in as many relevant extracurricular activities as possible is definitely advised. And if that isn't possible because you must work to support yourself and go to school, focus on the skills you use and apply in that job that are relevant to the internship. So I wanted to talk a little bit about the employer's point of view. And by point of view, I mean thinking about filtering all of the great skills and creativity and experience that you have to offer through a different lens. So instead of leading with what you want, show the reviewer what it is you have to offer and how you will be an asset to the organization. While there is a learning component to the internship, there is also work to be done. And as you progress in your career, that will be increasingly important to any organization that is considering you for a position. Will this person be successful in the job I am trying to fill? Will she or he be able to do the work that needs to be done? The fact that you understand these realities of the job market and can articulate them in print or in person will go a long way to setting you apart from the pack. Many of you will be, that are in school, will be acquiring a set of technical skills. But there are also what I'm calling fundamental skills that are equally important, and in some cases maybe even more important than the technical skills that you'll need for a job in global health. And so I recommend really starting to acquire them as soon as you can. It will be extremely difficult, in fact, to find a professional level position in global health without them. So the skills portrayed on this slide are indicative you know, of the ones that I think could be very helpful and useful. Please keep in mind that there is no single path to a career in global health, and I'll talk a little bit more about that later. And in the case of number 3, there are skills here that are not necessarily those you will learn in school or on the job. So resource optimization, for example, is a highly desirable skill and one that is required every day for those managing tight household budgets. And as you acquire these skills, make sure that you find a way to incorporate them into your internship materials. I wanted to tell just a brief little story, kind of related. One of our fellows who works in the cross-cutting area of population health and environment in sub-Saharan Africa faces several cultural-related challenges in her work, including managing donor expectations and managing community expectations. While both sets of expectations may be equally valid, they can often be at odds with one another. And being able to navigate between the two is really essential for her success in that position. These kinds of challenges are complex, involving multiple stakeholders, funding limitations, and cross-border issues. Often certain factors will be beyond your control in a position, and yet there is still the job to be done. Some other very useful skills and experience include project management, systems thinking, budget and resource management, analysis and problem solving, and a language proficiency other than English. Intercultural experience, whether that's here domestically within the U.S. or overseas, experience with donors, also very important. Project implementation and design experience is also very valuable. If you've not had overseas experience, then focus on the skills, these skills that are transferable to the international arena from your domestic work. And also focus on how your domestic experience in a resource challenge setting could translate into understanding the developing country context. In talking about distance traveled, really what I'm getting at here is trying to the best of your ability to utilize your unique skills and experience, and also showcase those. So we'll be looking, especially in the internship evaluation process, we'll be looking at the distance traveled of the applicant. So what does that sort of mean exactly? This has to do with overcoming obstacles in your life and your career, and how far you as an individual have come to get to where you are now. So for some students, especially those from populations traditionally underrepresented in the field of global health, their lives may be defined from early on by the need for resilience, flexibility, adaptability, collaboration, problem solving, navigating ambiguity, and shifting circumstances. These are all highly desirable skills for global health professionals. So if you have these skills in any context, make sure that a reviewer can see them. And we've all experienced difficulties and challenges in our lives, so you want to be prepared to articulate how you've grown or learned from them and incorporate them into your application materials. Also, there is more than one path to a career in global health. Perhaps your education and experience thus far is based in domestic health. Maybe you have a background in community health and you worked or volunteered with immigrant populations in a resource challenge setting. Look for the transferable skills here and make sure that they stand out in your materials. The work world is different from the academic world. One of the things that recruiters are looking for, especially in early career professionals, is a sense that a particular applicant will be able to take his or her academic accomplishments and build on them to be successful in the professional world of global health. The reality is that the further away from your degree you get in years, the less importance it holds for a recruiter or hiring manager. Have you been able to take your education and use it to become successful in the work environment? So what have you done lately is really the mantra. At GHFP-II, we're seeking individuals that not only have the theoretical training, but the ability to translate that into a work context. Office skills are important, people skills are important. So as you move forward in your career, where you received your degree or the courses you took will hold much less value for a recruiter or hiring manager than what it is you have done with your education in terms of finding meaningful work and producing measurable results in your field. So I just wanted to leave you with a few final thoughts on the internship process. Don't rush through the application process. This may not be easy advice to take since we're all very busy in our lives, in our work and school. At our program, we know from past experience that a large percentage of the applications for our internships are submitted within the final 48 hours before the deadline. Some within, just many within the final few hours. So if you're working on the something is better than nothing principle, please reconsider. You'll be doing yourself a disservice by submitting a bare bones application package. That's really not the way to stand out from the crowd. Don't assume that a reviewer will automatically know things about your background. If there are things you want them to see, make sure that you have it front and center in easily understandable language. And really take a little bit of extra time to prepare and make your materials the best they can be. Be sure that your submission is not redundant. Think about each answer for the essays, for example, as being read with the others to create a cohesive application. And then some final thoughts on your global health career in general. Working in the field of global health can be exciting and fulfilling, but it's not for everyone. The only way you'll know if it's right for you is if you experience it for yourself and continue to build on that experience. The field of global health is fast changing. Issues change, funding changes, priorities change, the science and technology changes, policies and politics change. To be successful, you have to keep up. So be strategic. Keep checking in on what it is you want to do in your career, then do the things that will help you get there. Join and contribute to listservs and blogs. Check relevant websites. Review job postings, even if you aren't eligible, to keep abreast of trends and skills desired by employers. Network, create a community. Make and keep contact with organizations and individuals that interest you. Update your skills. Look for and highlight your transferable skills. Technology is becoming increasingly important. Don't burn any bridges. Despite the name, the global health world is a relatively small one. And above all, enjoy the process. So these are the resources that I mentioned earlier. There are different organizations that, in our view, would be great to connect up with. And then I wanted to just kind of leave you with what is it that you can do between now and January to make yourself more marketable. Attend and or volunteer at one relevant conference and be strategic in your participation. Volunteer domestically with an organization that works with immigrant populations. Research organizations that interest you. Set up informational interviews with people you can learn from. Utilize your university contacts. Redo your resume and focus on transferable skills. Look at your career from an employer's perspective. Develop an elevator speech. Subscribe and participate in at least one global health-related blog or listserv. Join the GHFP-II listserv at GHFP.net to receive our internship and fellowship announcements throughout the year. Research USAID online. Look at what the different divisions and offices in global health are working on. Do your interests and experience align? If so, make sure they are prominent in your resume and essay. Focus your schoolwork in areas that are of interest to USAID or other organizations that you're interested in. Bone up on where the agency is focusing and how your skills could be applicable. Read about the agency's investments to date. Have excellent qualitative and quantitative research skills. If, for example, your data analysis skills are rusty, polish them up. And then consider going to our website at GHFP.net, and under the internship tab, you can review the bios of past interns to get a sense of their backgrounds and skills. So that concludes my section of the webinar. I hope it's been useful to you, and thanks for listening. Jennifer, back to you.
Thank you so much, Bob. You provided a lot of great tips and information, which I'm sure everyone found quite useful, as I did. So the results from the third poll should be available now. Star, could you please display the results? Okay, and if you remember, this question was, what are some of the barriers to a career in global health? And it looks like everybody, selected each one that we provided. So there was unfamiliarity with the field in general, financial barriers, gaining developing country experience, family concern and resistance. And it looks like most of you selected financial barriers and gaining developing country experience. So there are definitely many perceived barriers to pursuing a career in global health. I really hope that hope that the information that Bob provided helped you think about your own path to global health and how to best present the unique strengths and experiences that you have. As Bob mentioned, there are many paths to global health, including the one that you are on. And just to remind you, if you're using the closed captioning feature and the window closed, you can re-access the feature by clicking on the media viewer icon. And I'm sure that many of you have follow-up questions after listening to Bob's presentation. You can submit any questions you have through the Q&A feature. We'll make sure to try to answer as many of them as we can at the end of the presentation. And when you're sending in your question, please make sure that you select all panelists. And now I'd like to introduce Burke Betts. Burke will give you an insider's perspective as to what it is like to be a GHFP-II intern. Thank you, Burke, for joining us.
Hi, I'm Burke Betts. I was the Orphans and Vulnerable Children Monitoring and Evaluation Intern this summer in Washington, D.C. at USAID's office there, the Global Health Fellows Program. I grew up in Quigilinguk, Alaska, a small remote Alaskan Native village in rural Alaska, and became acquainted with health disparities and developed my interest in health as a high school student there. And then left to pursue training in biology and global studies. I'm currently an epidemiology graduate student at the University of Washington. And while I've been there, I got involved in global health and HIV prevention research. And that all started moving from my Alaskan village to college and to a study abroad program that sent me to rural South Africa, where I was working with a small community-based organization. And I was assigned to help do some community needs assessment work and surveillance for orphans and vulnerable children. And I was part of a team that was surveying a local community and identifying child-headed households and other orphans and vulnerable children who were not receiving government social services. And while there, I encountered, obviously, a number of children affected by or infected with HIV. And many of my closest friends during this experience, where I spent 6 or 7 months in South Africa, were children. And I spent a lot of time listening and observing, and I left and continued to ponder what to do with my career, and was really inspired by my friends, by the children I interacted with, to pursue a career in global health. And so I kind of came from a family of academics and a little bit of scholarship in there, so I thought, well, let's pursue a graduate program in epidemiology and get involved in research. And at the University of Washington, I found some opportunity to participate in some PMTCT and voluntary testing for HIV studies. And so I applied for positions like that at USAID, and I was surprised to hear back instead of those positions from the Orphans and Vulnerable Children team, who had an evaluation position open. And my skills were primarily in research, but I thought, you know, I don't know a lot about program evaluation, but I care a lot about HIV and vulnerable children. So I jumped at the opportunity. And when I came in, a process had just started, initiated by the Office of the Global AIDS Commissioner to revise the evaluation and reporting strategy for PEPFAR and each of the technical teams in USAID that support PEPFAR's mission. And I quickly learned that the Orphans and Vulnerable Children team wasn't happy with the indicators that they were reporting on to Congress each year. In fact, we were reporting on one indicator saying pretty much what services have we distributed this year through our implementing partners. And it wasn't telling the whole story of how effective these programs were for children affected by HIV/AIDS, and it wasn't showing any impact. The indicator was unable to. And so the OVC team formed a cross-agency technical working group, a TWG, with individuals from CDC, Peace Corps, the Office of the Global AIDS Commissioner, and USAID. And we set out to revise the strategy for M&E and global reporting. And we began as a team to develop indicators to assess program impact, program effectiveness. And I was a large part of that, and also developing reference sheets to explain these indicators. I was also involved during my internship experience in charting and graphing the metadata for PEPFAR's semi-annual reporting cycle, and for reviewing a toolkit created by Measure Evaluation, and in a number of a research protocol, a data analysis plan was set out basically to enable implementing partners to evaluate their programs. So that not only do we need to report at a global level the successes of PEPFAR, USAID programs for children affected by HIV/AIDS, but each program needs to be tracking their effectiveness and their impact to some level. I also was involved in reviewing country operating plans from the 2013 calendar year and looking to see what implementing partners had scheduled and planned as far as monitoring and evaluation. This internship experience was extremely rewarding for me. I wasn't expecting to sit on a committee with a technical working group with numerous senior technical advisors, and it really allowed for substantive work impacting global health policy and practice, and really broadened my horizons and enabled me to see a bigger picture of donor-driven health activity, of what USAID is doing in global health and development, of how USAID and other large donors interact with implementing partners who are accomplishing and implementing the projects. It also allowed me an opportunity to do or to apply my research skills to, or at a system level, to help assist with programs and to measure their effectiveness. And I'd come in with this research skill set and had planned to continue in academia, maybe go get my PhD, but with the help of my on-site manager and my experience there, I was able to start mapping out a new career trajectory that was a little bit more appealing to me, and using my new skill set, using this guidance to just come up with a new plan. And the on-site managers that I interacted with, including my own, were very invested in the intern's personal development, and that is something that I wasn't completely expecting, but I thought was a hugely rewarding activity. Also, networking is an amazing opportunity with the GHFP internship program. The on-site managers and the GHFP support staff were really instrumental in setting up a number of networking opportunities with global health fellows, with implementing partners, monitoring and evaluation advisors, which was very important for me as I broadened my horizons. And as I said, this was just a hugely beneficial experience for me, and I was allowed to be involved at a fairly high level and really enjoyed my opportunity as an intern at GHFP USAID. Back to you, Jennifer.
Thank you so much, Burke. That was great. Thank you for sharing your experience. And now we have our final poll question. In thinking about your path to global health, what are your next steps? So you can select any and all that apply. And now we're going to move on to the Q&A portion of the webinar. We have many staff available to answer your question. Bob Leone and Burke, who you heard present earlier, as well as 2 additional staff would like to introduce to you. Jennifer Candy is GHFP-II's lead for recruitment. Jennifer has extensive experience in the development field and filled hundreds of specialized positions for both Washington, D.C. based and developing country openings. And we also have Dr. Fernando Fuentes here, who is GHFP-II's lead for inclusion and diversity. Fred leads GHFP-II's efforts and strategies for enhancing talent diversity and fostering an inclusive work environment for both our fellows and interns. And before we jump into answering your questions, I'd like to remind you that you can still submit questions to the panel through our Q&A feature. So now for our first question. I think this one might be good for you, Fred. What tips do you have for individuals that want to get involved in global health opportunities as coming from a non-public health background?
Yes, this is Fred. Can you hear me?
Yep, I can hear you, Fred.
Okay. Students coming from a non-global health field, such as myself, I had a master's degree in science and a bachelor's degree in science, and my doctorate is in education. So I can definitely relate to that question. I think some of the things you can do is, as suggested by Bob, is incorporate yourself in the local community and opportunities that allow for that diverse experience, whether that's, as he stated, working with the United Way, volunteering at your local family planning clinic. Getting involved in the community can go a long way. So that's how I'd answer that question.
Thank you, Fred. Here's one for you, Jennifer. If you are a doctoral student, would you be considered overqualified for an internship position?
Hello, everyone. This is Jennifer Kindy. Thank you, Jen. That's a great question. Yes, we do have internship positions that we would consider PhD, and we've had lots of PhD interns work with us on various positions or internships. So sometimes we would specify, or if it doesn't, at least the minimum is usually a bachelor's. So we do have some requests that require, or at least a minimum of a bachelor's. And we do have other requests that require a minimum of a master's degree. And PhDs are welcome to apply for at least a master's level. And we compensate based on the education level. But yes, we do have lots of PhD interns. Thank you.
Great. Thank you, Jennifer. Here's another question. It says, can interns reapply if they don't get the position the first time? And I'll take this one. So as long as, let's say you apply for, summer 2014 internship and you aren't selected, you could apply for another internship that opened up throughout the year as long as you met the requirement. So you would just want to make sure that you read through that position description. And, if you're still, if it says a recent graduate within 1 year and you meet that requirement, then you can certainly apply for a different internship opportunity. And then here's a good question. What percentage of 12-week summer internships are abroad versus home office in DC? Bob, would you like to take that one?
Yes, sure. So a percentage, I couldn't really give a percentage because it's different every year. But I will say that it's going to be a very small percentage of the summer internships will be based abroad. The majority will be based in Washington, D.C. However, many of those positions will have overseas travel related to the internship as part of, the summer experience.
Great, thanks, Bob. Here's a question for you, Jennifer. It says, to recruiters, what are some of your pet peeves when reviewing resumes and when reviewing cover letters?
Thank you, Jen. And actually, these are Bob covered a lot of these pet peeves. Definitely grammar, tailoring. Grammar is a big thing, but also making sure that you tailor your resume and cover letter to the position. If we don't see anything that's relevant, that might not, again, appeal to us or the hiring manager. making sure your sentence structure and the information you provide on your cover letter and resume makes sense, it's relevant, it's concise and to the point, making sure that the formatting looks good. The other thing is, if we look at resumes and for some people it might not be appealing, just make sure that even if you have a friend take a look at your resume or cover letter, just to see, what it looks like. Does it need, they may help with helping with formatting and just the look and feel. Sometimes just a simple resume, a simple format might be the best way to approach, rather than adding tables and definitely no pictures. We don't want pictures or any personal information, and those are just a few. But making sure the content obviously is the most important. If it's not relevant, then if you didn't take the time to make it relevant, then that might be something that would throw the resume out of the running. Thank you.
Great, thank you. Fred, this kind of relates to the earlier question, but maybe you can add something to this. What if I don't have a lot of public health experience? Is that a negative impact on my application?
Thank you, Jennifer. If they don't have a lot of experience, the question is that a negative? It doesn't have to be a negative if you can articulate the experiences that you've had and your involvement in a career or position that is similar to working in global health, volunteering, as we stated earlier. So I don't think that would limit you in any way, and I would still strongly encourage you to continue and even apply. Thank you.
Thank you, Fred. Bob, here's a question for you. Is there any advantage in submitting an application well before the deadline as opposed to any last-minute submissions?
I don't necessarily see. I mean, there's no. It doesn't sort of put you in front of the pack or anything like that. But from the person who's doing the application, I think you're sort of in a better frame of mind if you're not down to the deadline, because that's, I think, the point where you start thinking, well, I need to kind of slap this together really quickly and get it out there, and that's where you make some of the mistakes we've already talked about in terms of grammar and construction, or leaving things out, or maybe thinking, well, if I had some extra time, I could have, done some more research. I could have included that into my submission. So, those kinds of things are things you'd want to think about.
Great, thank you, Bob. Maybe I'll put this up to whoever wants to answer it. I am an RN with years of public health experience here in the States. Is there an advantage to frontline experience in applying for internships? Is there an internship focused on frontline, providing care as well as research?
Hi, this is Jennifer. I can answer a little bit of that. So we do have lots of, I would say, fellowships and even interns where having that clinical experience sometimes comes as an advantage. So let's say like the HIV/AIDS type of positions, both for interns and fellows. We've had lots of interns and fellows with nursing type of experience. So we have seen this type of experience, and it definitely is not a deterrent in terms of applying or being considered for a position. And we do have lots of even hiring manager with that type of background. Thank you.
Great, thank you, Jennifer. Here's a question. Is there a limit to the number of internships you can apply for at one time? So I'll answer this. So for the summer internships, you can apply for 2 internships. So there is a limit. So you want to make sure you look through all of the internships that are open and pick out the 2 that, most meet your interest and the experience that you have. Let's see, let's find another one. Would anybody in the panel have advice for international students interested in a career in global health?
I could also take a stab at that. Definitely going to resource challenge areas, doing work in the different areas, wherever you are, whatever part of the world you are, adds to your portfolio of experiences. So looking for anything that would be considered public health or global health, depending on where you are. But in terms of our type of roles, we do require U.S. Citizenship and U.S. permanent residency to be eligible for those positions. But again, if you already have this, but you're in a different part of the world, continuing to look for positions within global health or public health would be definitely important. Thank you.
Great, thank you, Jennifer. So here's, we're kind of coming to the end, but here's another question. I'll put it up to whoever would like to answer it. At one point, do you decide that an application is worth forwarding to, a hiring manager?
Hi again, this is Jennifer. I'll take that. When it meets the requirements of the position, then we definitely want to forward. So if it's, let's say, an HIV/AIDS internship and what they're looking for, based on what they're looking for, the person has the type of experience and expresses the experience on their resume and even within their essays, and it's relevant, that's what we would be looking for, and that's who we would forward. So the relevancy, and in some cases, if they don't have actual experience, but volunteer experience, it might not be actually paid positions that they have this experience in, but they have volunteered, or the type of projects they worked on while in school would be considered relevant for an internship. So it's how they express this that's compelling, and if it catches our eye, we definitely forward. Thank you.
Great, thank you, Jennifer. And here's one more question. I'll take this one. If I'm planning to enroll in an MPH program but need to work for 2 years first, will I be eligible? So this person will be graduating this spring with an undergraduate degree. And the answer is, as long, you want to read through the internship scope of works as they become available. And as long as that internship is open to a recent graduate of an undergraduate program, then you are certainly eligible to apply. And we often have internships that are available to people at the undergraduate level. So you'll just want to make sure you read through the scope of work and just check those requirements, but there may be internships available that you could consider applying for. All right, and I think that about wraps up the time that we have. I did want to take a moment to call the results from the fourth poll that we had. Star, could you please pull up those results? So the question was, what are your next steps? So the options were following up with GHFP-II, learning more about opportunities in global health, testing out my networking skills, and eating a snack and taking a nap. And it looks like most of you are talking about following up with GHFP-II and learning more about opportunities in global health, so that's great. Sounds like a great plan. And if you are interested in following up with us, there's information on this slide. There's a link to our website, as well as links, information about our Facebook and LinkedIn. If you go to our website, you can find a place where you can sign up for an informational interview, as well as our email list. And again, I'd like to thank all of the panelists and presenters who helped out with this webinar. And please feel free to connect with us at the sites that I mentioned. You can also, I forgot to mention too, you can also follow us on Twitter at GHFP-II. Again, thank you all for participating today, and best of luck in your internship search.